your confidence and skills. Our journey. Mental health first aid for First Nations. To let you know, I was employed with the Commission since November 2016. So a lot of the past up to the present today is what I can confidently speak to. But as far as the past, we're looking at how the Mental Health First Aid First Nations course was developed. It's important to understand the historical context as to where we come as Indigenous people. So in order to move forward, it's important to understand the present to understand the past. And that's a quote from Dr. Betty Bastian from the Bikini First Nations. I think that quote itself is so important, and hence when we look at our First Nations adaptations, we can totally understand why the historical piece is important, because it grounds our work as to where we need to go next. It gives us a good understanding and a foundation for the First Nations adaptation. The timeline of mental health first aid for First Nations. Anthony Durham and Betty Kitchener from Australia developed the Mental Health First Aid Basic in 2001, and that itself spread across 23 countries worldwide. In 2010, Health Canada recommended mental health first aid on the basic form be adopted for First Nations. Therefore, that came forward to the Mental Health Commission, and then we started looking at some course development in 2011. In 2012, the guidance group was developed. Essentially, the guidance group was selected among health experts, Indigenous scholars, and folks across the country of Canada who had different expertise and skills in mental health. And so with them as a guiding group, there was 14 to 16 participants that had opportunity to look at developing and shaping the curriculum of the First Nations adaptation. In 2013, the course material was reviewed and it was tested in 3 pilot sites. One was in Ontario, Manitoba, and BC. In 2016, the course evaluation by Claire Crooks and her crew looked at the mental health first aid for First Nations, and they basically evaluated the program itself. And the course has been actively delivered since this time. So fast tracking to today, we right now currently have 76 First Nation co-facilitators trained, and we have 2,427 people trained in mental health first aid for First Nations. So when we look at recommendations, our recommendations today come from various folks. Some recommendations came from Health Canada, the Assembly of First Nations, the Mental Wellness Committee, and First Nation communities themselves. So when we receive these recommendations, it's something that we take seriously at the Commission. It's definitely documented. We look at the recommendations and we incorporate them into the course manuals and whatever other documents that are necessary, such as the applications, the handbooks that are necessary for the instructors. And we are now working on, we have live documents of the First Nations co-facilitator manuals and participant manuals. Some of the recommendations included that there was the number one recommendation was that we look at cultural safety, and that we look at the text and use plain language. We wanted language to be very straightforward and to increase the length of the course. Right now, the Mental Health First Aid Basic course is a 12-hour course, whereas the First Nations adaptation is a 20-hour course over 3 days. They also recommended a refresher for graduates. So those are essentially co-facilitators who have taken the course, that after every year they would take a refresher course to be on top of the coursework and any other curriculum changes. Another recommendation was to develop a self-assessment guide for community readiness, develop a standard evaluation for course feedback, and to look at a community-based model. At the present time, what does mental health first aid look like? The First Nations adaptation. Currently, right now, we are delivering the First Nations course to look at cultural safety. we look at the determinants of health that are taken into consideration, encompassing a holistic approach. So with this, when we look at the manuals itself and we bring a group of community members or participants together, we're looking at a holistic perspective in that we're including the body, spirit, the mind, and the heart. And that itself is weaved throughout the entire course. Distinct differences between the Mental Health First Aid Basic and the First Nations Adaptation is that in the Basic, we're using the acronym ALGE, and for the First Nations Adaptation, we refer to EAGLE as our acronyms that we go to as far as the learning module for delivering mental health first aid. We're also looking at a circle of support, walking in two worlds, the elders, support persons, and sharing circles. We'll talk about this in the following slides. For the First Nations Adaptation, the modules itself are similar to the basic. However, the modules, the very preliminary modules are different in the sense that we provide that historical component, and we talk a lot about who we are as Indigenous people. We talked about our shared and lived experiences. We touch on the 60s scoop. We refer to the residential schools and all the trauma and the impacts from those experiences. And that again shapes as to the foundation where the course goes over the next 3 days. Module 2, we cover the foundations of mental health first aid, and so on. You can see there. Number 3, the pathways to recovery. Module 4, substance related. Number 5, refer to self-harm. Number 6, we talk about anxiety and trauma-related disorders. In Module 7, we look at psychotic disorders, and Module 8, we look at the journey to wellness and what does that look like for each person. Here's a snapshot of the modules. I know it may be small, but I'm sure you can get them. I don't know if you're going to be distributed the webinar, but that essentially covers the different modules, the 8 modules. So EAGLE itself, the acronym E is for engage and evaluate the risk of suicide or harm. So if I can back up for a moment here, when we look at EAGLE, EAGLE is the process or the framework that we use as a guide when we're helping someone going through a mental health crisis. EAGLE itself within the course throughout the 3 days, after each module, we're looking, not after each module, but throughout the modules, 8 modules, we always refer to EAGLE, and everyone always has an opportunity to practice EAGLE, and what does that look like when you're doing some group work. So E is you're engaging and evaluating the risk of suicide or harm. A is assisting the person to seek professional help. G is giving reassurance and information. L is listening without judgment, and E is encouraging self-help strategies. Although E is in, the EAGLE is given in this form, it's not necessary that EAGLE is being delivered as support in order. So you can listen without judgment. Maybe that's all you're going to do at one point in time. Maybe you might encourage self-help strategies. So there's no right or wrong way on how you deliver the support. EAGLE can be used any way, but it's basically there to support the person. This is an example that we have from the modules. The circle of support is something that comes on a huge wall, I guess a wall poster, a non-whiteboard. Every co-facilitator has a module of, a copy of EAGLE, and they also have a copy of a circle of support. Basically, the circle of support is a tool that you'll use throughout the 3-day course, and it's in the shape of a medicine wheel. In there, we look at different components based on the body, the mind, the spirit, and the heart. And you get to basically use this as a guide or a framework for the group to talk about and have a discussion as to who your supports are within your community or your organization. Some of the examples of the circle of support may include the traditional healers, ceremonies, community service providers, elders, etc. So basically, each community's circle of support will look different. The beauty of this is that I've taken the Mental Health First Aid First Nations several times in different communities. So the beauty of the circle of support is that by the time you're done with the program, everyone in that group will have a good understanding as to what the supports are available to them within the community or organization. Often we find that when we're reaching out for support, we say we don't have enough supports, or there's no one to turn to, or the waiting lists are long. When you look at your circle support and you step back and you say, wow, like look at all these supports that we have. So essentially, also another benefit of the circle of support is that when people are in the sessions themselves, taking the course, they begin to network, they learn about one another's programs, and then they start meeting one another. It's an assumption that when you're in the community and you're working with your people, it's an assumption that we all know what everyone is doing. And in essence, really, that is not true because from what I've witnessed is that several folks will learn about different programs within their own community, and sometimes they'll realize, like, wow, I didn't even know about that program. I didn't know that existed. So that circle of support is very important. And again, that is looked at throughout each module of the course. So that way you keep adding to it, you keep adding to it. By the end of 3 days, you have a wall that's filled with supports, and it is a really good handy tool. This is an example of the circle of support. By the time you're done, like I said, this whole page is full. Walking in two worlds. This is important because when you're Indigenous, and this is often talked upon, basically it's talked about wherever you are, it doesn't matter where you are. Walking in two worlds is really significant for us as Indigenous people, only because we're acknowledging our experiences of living both in the First Nations and mainstream Western world. What that means and what that looks like will vary. It'll differ for everyone depending on who you are, where you're situated, where you work, and what you do. So what that looks like for each individual will vary pending their role, their experiences, and connection to both lived experience. So for myself as an Indigenous person working downtown Ottawa, it's finding that fine balance and how do I work within mainstream and then take off my hat and then step into our world, which are two different worlds. So it's adapting to those worlds and understanding that we can coexist and respect one another and understanding how that works. So that walking in the two worlds is very important with Mental Health First Aid First Nations because we learn that we definitely can support one another and we can walk down the same path supporting our needs, especially when we're looking at addressing mental health. These are a few stats I have. I just realized that I did send Nicole my revised PowerPoint, but then I started revising it and came up with more stats and failed to send it in time. So again, like I mentioned earlier, today we have 76 co-facilitators trained who are able to deliver mental health first aid First Nations out in the communities across Canada. And we have 2,427 participants trained in mental health first aid for First Nations. Here's a snapshot of a group of co-facilitators that took the training. These participants are from Prince George, BC, and Opaskwayak Cree Nation. What a lovely group. Future. Why mental health first aid First Nations for your organization or your community? The goals for the future are to have co-facilitators trained in each province. At this time, we have about 4 provinces that do not have co-facilitators trained to deliver the mental health first aid for First Nations. We're looking at seeking out some champion communities. Ideally, the champion communities could be those experts, subject matter experts, to be able to lead mental health first aid and essentially to look at someone as a big brother or a big sister to help them through the training. Another goal of the First Nations adaptation is to indigenize the program further. Right now, we're actively looking at the application process and trying to make that more familiar and I guess culturally safe for our people. We're looking at the manual recommendations. Again, this is a live document that is being actively worked on today as we speak. And we're looking at culturally inclusiveness. So wherever possible, wherever we can, our goals are to move forward in a culturally safe way and doing the adaptations wherever necessary and as recommended. How do I sign up for a course? In order to deliver a course, we need a minimum of 8 participants. And those 8 participants can be from the community or an organization. It could be a mixture of both. It just really needs one person to say, I love to take this course, and then from there building on up to 8 participants. We need a commitment of 3 days. It's important that when you sign up for Mental Health First Aid for First Nations that you are able to be there for the 3 days, because it's so important, because each day builds upon one another. In order to sign up, you can go online and check out the website, and then it's very straightforward in the sense that you're going to look for a course, and then you put in your request, and you send in your request. So our journey summary for Mental Health First Aid for First Nations, as you can see, we looked at the past, the present, and our goals for the future. In the past, to get to where we are today, we had a guidance group, we did some research, and we engaged some pilot communities. Presently, we looked at a community of practice. We developed the curriculum to adapt to the First Nations. We have instructor and participant manuals that are culturally sensitive, and we have master trainers. In the future, we're looking at increasing capacity by delivering co-facilitator training and potential for shared community resources and partnership. At this time, we are looking at creating some partnerships. It's something that we're close to finalizing, so we are moving ahead in the right direction. This is the end of the webinar. Any questions? Nicole?
Hello.
Hi.
Hi, Anne. Sorry, it's Claire. I was talking, but my microphone wasn't picking up, so I switched to Nicole's computer. So I'm going to help facilitate any questions. For people who have not used this technology, you can just write something in. So from Kent, Anne, there's a question: where can I find the website to apply for the course? And I think if you click to the next slide, it's right on there. Was it? There.
Okay. Yep.
All right, so Kent, you can go to the Mental Health First Aid site, and it'll say find a course. Or else, I also heard Anne say that if you're putting a group together, it sounds like you could contact them directly to do that. All right. Other questions for Anne? Well, Anne has provided her contact information. Okay. Could you copy the link onto the chat? It's not live on the slide. Sure, I will try and do that. Okay, let me. Okay. Carrie's going to do it. That's one of our colleagues here at the office. It's beyond my technological capacity. Any other questions while Carrie's typing that in? So just if I want to thank Anne, but first, before anybody starts to sign off, I was wondering, I should have done this at the beginning, but if you could just take a minute and type into the chat box where you're located and your role or interest in this, it would be very helpful for us in terms of getting a sense of who's doing this. Oh, one more question from Jamie. For those of us who've had the basic and the one oriented to youth, will there be offered a section to just add on to our already held certification, or do you have to redo the full course? Anne, do you want to?
Yeah, I can respond to that. So if you do have the basic that you can add on, the Mental Health First Aid for First Nations is totally a separate adaptation, and that you will have to take the full entire 3-day course. And essentially it's because Module 1 talks about that historical component, which really grounds the work for the next 3 days. And then you have all the shared and lived, like the differences with the First Nations adaptation is that a lot of it is experiential learning. So you have those shared and lived experiences and those stories that come throughout those 3 days. And then in addition to that, you have your elder with the opening prayer, the closing prayer, and you have sharing circles. So there's a lot of differences that make it something important where you have to be there for the 3 days.
And Anne, I think when we talk about our findings and the evaluation, it really captures what you're saying, that it is that whole process and group process over the 3-day span. It's not just about additional information or content as much as being part of that whole 3-day process.
Mm-hmm.
All right, you have a few more questions here, Anne. So Gregory is wondering, their community's thinking of running one for youth. They'd like to do that in conjunction with a youth peer support training. Do you have any advice to offer?
So for the youth, what I've been sharing with the folks in the communities that I've attended is that in addition to mental health first aid for First Nations, the Mental Health Commission has a program called Headstrong. And I've attended a few Headstrong sessions, and I would say without a doubt, hands down, Headstrong is the way to go as far as it's similar to mental health first aid in the sense that we talk about decreasing stigma and we look at acceptance. And that itself would be something that I would recommend.
Great, thanks, Anne. And so Star was also asking that question. So again, thank you to Aurora College for saying where you're located. If anyone else doesn't mind, maybe just giving us a quick, great, Brockville, super. Thanks, Kim. Okay, so Anne, any other questions? Oh, was there an online course? And do you want to talk about whether there's any,
Yeah, no, unfortunately, the course itself is not something that can be honored online. And again, it's because of those experiential learning experiences that you're connecting with people, and we actually have the medicines, and everything is part of a shared journey. So I think it's probably, I wouldn't say next to impossible given our technology nowadays, but at this point, it's not something we offer online.
Again, I think when we talk about what the lessons that came out of the evaluation and what was really transformative for people, it really was that experiential learning that Anne's talking about, and we'll go into that next week. Was there another question? Have there been other countries that have adapted mental health first aid for specific programs for Indigenous populations?
That is a good question. I'm not sure in regards to, I know for sure Australia has the Indigenous mental health first aid. Other than that, I don't know.
I think New Zealand did some early work with Maori populations, but I don't know if they ended up with a completely separate program. Okay. But yes, certainly Alberta. Okay. Okay, so Anne, thank you so much for taking the time today. I think you really captured how this program has worked to bring together evidence-based strategies into a format that's locally flexible and responsive to individual communities. Again, this is part one of a 3-part webinar series, and we welcome you all to join us next week where we'll talk about the research outcomes. Also, all right, so Carrie's just posted the link for information. I'm also right now going to post the link to our website, which has, we will post the webinars here, and we'll post both the slides and the recorded webinars. And there's also already a summary of the research there for people who are interested in that, and some other presentations you can take a look at. So thank you again for joining us today, and we'll hope to see you all next week.
Thank you, everyone. Thanks, Claire. Thanks, Nicole.